with us this morning is a guy who has been true to the public option the whole way along, and he will take your calls this morning, 1-800-357-0910, and his name is Congressman Joe Sestak, fresh off sitting on the O'Reilly factor last night. Good morning, Congressman. How are you?
Good morning. It was enjoyable last evening.
Well, you picked up an endorsement last night. Did you know that Congressman Weiner was going to endorse you for something?
Not at all. I was sitting there. He had arrived about a minute before we went on. I said hi. We chatted for 30 seconds, and boom.
Well, it was interesting, and we appreciated the point of view you took last night, by the way, on the civility in Congress. You have been true to that. You and Pat Toomey, when you have been together debating, have certainly demonstrated that you can do it civilly and not have to be
you pointed that out last night, too.
Well, thanks. I really do believe it. But as I said, it had to do with my military background. People think the military is just yes sir, no sir. No, we argue pretty vociferously because we're going to lead men and women into harm's way. But at the end of the day, you come together, and it's not personal. It's a debate of ideas, not personalities.
Well, but the thing, too, is you argue the issue, and you don't go out and the first thing you say is, okay, here's my point of view. And then somebody comes back and says, well, here's an opposing point of view. And you go, well, you're an idiot. Well, that's not a debate. And unfortunately, in our country, that's what it seems to be becoming anymore. And you look at what's being said out there, and it's a shame. I mean, and especially when you have kids looking, talk about looking at role models beyond your parents. You look at, hey, Mom, maybe I want to be a congressman someday. And then you look up there and you see that nutcase from down in Florida right now talking, and you say, holy crow.
You're spot on. I mean, as I said last night, I joined the military, and we were 15 out of 15 in 1970 during the Vietnam War in terms of public confidence. When I left, we were number one at 78%. Came to Congress, and it's dead last. But the issue here is people you hit it so well, we should be role models. People should desire, I'd like to get in that business. And that's the gravest damage to America, is the loss of faith, trust, credibility in public officials in Washington, D.C., and therefore it harms our public institutions in the Constitution. Well, that's the damage.
People who are in your position, as you point out, should be role models. Young kids should look at people like you and go, you know what, I want to be like that person. But then what they see, the other message, the mixed messages that they get too often, is they see somebody who is ideologically inflexible, communications-wise, they only know to demagogue or call names, and then get caught up in all kinds of scandals and controversies. And so, where is the role model?
You're spot on again.
Yeah.
I honestly do believe that we have to somehow resume having principle mean more than a political calculation. As I said, people should be in this business for conviction, but when they have that conviction, they have to understand there's respect for the other side. Those town halls across Pennsylvania that occurred of this nation. Look, I don't care what anyone said. Those were Americans who had a lot of anxiety. Now, some were a bit overboard, but heck, that's just politics. But the vast majority had legitimate concerns about what federal government was trying to do. Am I a big supporter of the public options we'll get into? You bet I am. But I need to listen, but I need to explain in a way that has a civil debate.
Well, I want to tell you, I have come around to your point of view. I have decided that I am totally in favor of the public option. In fact, I'm going to go a step further. I have decided that, as Nancy Pelosi said yesterday, I like the word consumer option better now to describe that, because I think that the public option, the idea of being able to buy across state lines as a public and being able to buy my health insurance like I buy at the grocery store and being able to buy Blue Cross Blue Shield in one state cheaper than I can in another state, to me, that is the best public option out there. So I've come around to your point of view.
Well, thanks. But I think you put a good mentions out there also. Gosh darn, the Democratic caucus, we don't know how to explain things. We say public option, consumer option. We should have thought of that. Or we should have called it Blue Cross Blue Shield Junior or something.
Well, the problem is, though, that my public option is not one you've even considered yet as a Congress. My public option is one that takes away and makes portability possible across state lines, and so far it's like all these different things they're trying to do. And I know you're upset right now because you're a guy who's been true to the public option the whole way through. I may not agree with you, but I appreciate and respect your position. But they have bastardized your public option so badly now that no one quite knows what it is. And it all has been stolen away from guys like you with principle by people who now are in there with politics.
We still have a chance for the public option on the House side to prevail that I'm a supporter of. And, it has a large part of what you just mentioned. For example, the reason I'm not for the Senate side where you can let states opt out of a public option is these are public pools. It's a national plan.
Yeah.
So you can spread the risk all the way across. By the way, I'm not necessarily opposed to your concept at all about we could have done it maybe a different way, which is break down the regulations between states. Let you buy something from Alabama or California. The only issue, though, is we have to prevent a race to the bottom. For example, 9 of the states, let's take Alabama,
okay.
They forbid the right of appeal. So if you're sitting in, if you're happy in Harrisburg and all of a sudden you feel the insurance company didn't do something well, you can't appeal it because the headquarters of that company would be domiciled in Alabama. And so many of the companies, what you have to do is put a minimum set of national benefits if you do what you want to do. Otherwise, they're going to domicile themselves like they did when we broke down regulation of credit cards. They all went to South Dakota because there was no usury laws there. That's why credit rates went up to 35%. What you've got to do is set a minimum level of benefits so headquarters insurance companies don't race to the bottom to the states that have no benefit laws and don't even have the right of appeal. So that's why you've got to have another part to have what you want.
No, I absolutely agree with you, but I think this is where the hard work needs to be done, because I think as we sit in the room and we talk healthcare, and you've been gracious enough to talk with us a number of times about it, the big elephant sitting in that room is saying, okay, if you really want me to have a public option to me has always meant I have a choice here out of a whole bunch of different options. Well,
right.
If my employer happens to, at some point in time in this process, maybe not right away, but down the line, happens to opt out, I don't have a public option. My public option is gone. It's a private option based on what my employer is doing at that point, and I now must go along with that, or else I must go somewhere else and figure out some other way to do it. Isn't that a fair statement?
Well, it's a fair statement, except we fix it. Right now, if he does that to you, you have no choice but to find it on your own. What we do say to that employer is, okay, guess what? You don't pay. You don't provide Gary or Jim. You don't give them their health base anymore. You pay an 8% fine.
Yeah,
and which is more than they would pay to have that health care option. So that's how we prevent it. And that money, that 8%, then will go in and fund you within a fund in the public option, if that's what you pick. By the way, the public option is just one option to pick among many people, Blue Cross Blue Shield, Highmark. They can all put something into this insurance market for you and for individuals to pick. The last issue, though, is most important.
Well, let me just jump in very quickly before we get to the last issue, and then we're going to take some calls, too. It's interesting here. A lot of people, and you heard me say in the preface to introducing you, that when people are asked, "Are you in favor of public option?" They say, "Well, yeah, I want to get a better price out there." And I think nobody would argue, as you and I and Jim have agreed on, nobody would argue that we need some work to make sure that, especially the less among us, and I keep hearing from 30 to 46 million. The president uses both words interchangeably. It seems to me you got to decide on a number. We decide on about 10 to 12. The 15% of America that does not have health insurance, we need to do something to help them with that. Problem is, the government gets in between there and screws it up. And I offer to you the idea that people say, okay, I want a public health care option. And then you ask them, okay, do you want a new government entity getting in there to operate that, or even to get it as startup money? And then people say, well, no, because I've seen what they've done. And when you look over just the past year and what you all have done in spending our money, it's not exactly a gleaming Chamber of Commerce resume. And then we look back, and I wanted to throw this at you, Congressman. In 1965, when Medicaid was enacted, the House Ways and Means Committee estimated that the first-year cost, what we're talking about here, first-year cost for startup, estimated now, would amount to about $238 million. The actual price, $1 billion. The program now costs, this is Medicaid now, the program now costs $251 billion annually, and it's climbing fast. The record is similar for Medicare, 65. Congress predicted that by 1990, Medicare would be costing $12 billion. Actual cost in 1990, $90 billion. Do we want to, to me, insanity is going out to the same people who have done these things and saying, oh, now that doesn't count. Now you're going to do it better.
Do it again. How
do you make a case for Congress coming out and being anywhere involved in this and doing something good? That's insanity.
Well, here's how. If you, let's say 85% of Americans have a health care plan today. We'll take your number. We don't intervene at all. All we say is the only requirement is that those private health care plans have to provide the same benefits by the end of this coming decade, the next decade, that congressmen and women have, period.
But you have gotten involved at that point. I mean, it's easy to say we haven't gotten involved, but you've basically set a standard at that point, and you've said also in the bills that you must purchase health care. Where in the Constitution does it say we must purchase any? Do I have to purchase a certain kind of food now?
But it doesn't say anywhere in the Constitution you must have car insurance, and yet we mandate it. Why?
Through the states.
Because it does say in the Constitution, provide for the general welfare. And you have talk about cost. We lose $260 billion a year in GDP productivity because of the uninsured and the underinsured. Then that's why we say, wait a moment. Every American should have access to, and they don't have to. You can opt out as an individual and have no health care plan if you want. Mm-hmm. Okay? You're going to pay a fine, but you can opt out.
But you
Much
can't.
like if you just elect not to have car insurance, oh, boy. You know, that's
But again, constitutional, you don't have to buy a car. You don't have to have car insurance if you don't buy a car. But the point is, when did
But if you do, you must.
This idea of, and you're using the Chris Dodd thing, this idea of promote the general welfare from the Constitution is really flimsy. I got to tell you. I mean, that is really flimsy to say, oh, okay, so then that opens up a door. Nowhere in the Constitution does it say we have to buy certain things.
Where does it say we should use federal funding for roads or schools or for airports or for flight controls so pilots don't crash one another up there? And so except you know, you can take that all the way down. You have to make a philosophical decision.
No, it
here.
talks about appropriations of funds for doing things, and it talks about taxes in the Constitution.
Not roads.
Well, not roads,
schools.
Not roads specifically.
Not pilots that have an FAA system.
Okay, so...
And my point is
But then you cross over to now the individual's got to pay a certain amount of money then to buy a product, and they don't have the right to opt out of that.
They do have the right to opt out. They have to pay a fine if they do, but they have the right to opt out.
But that's just a tax increase.
It's a tax increase.
Correct.
You're putting money on someone. So, the idea that they can opt out and no damage is not true.
Yeah. Well, you bring up, this is a wonderful discussion point.
It is.
We have 14,000 Americans every day who lose their health care plan. That's the equivalent in 1 week of Reading, Bethlehem the next week, and Allentown the next week. So we can sit here and say, got it, understand. And then we just have, as we've had since 1994, 10 million more Americans lose their health care plan. And we lose $260 billion in GDP. Now, when we have a Katrina, there's a disaster, and we tend to intervene. My assessment is, look, much like car insurance, if you buy a car, I believe that you have to balance rugged individualism, but it's always in alliance with common enterprise. And this is a common enterprise that because of my doctorate in political economy, I stress the economics of this. 94% of all markets in America, according to the Department of Justice, all health insurance markets, that is, are non-competitive for pricing.
Okay,
but we can sit by and let a cartel dictate the prices to it, or we've come up with a fix where we stop the rise of cost of health care or slow it down, so all Americans can be more productive.
One of the reasons that I like you a lot is because you haven't been an ideologue so far, and I hope you never change in that regard. But you mentioned about Katrina. So if we go into Katrina, we say, okay, we got a disaster. We got to go in there. We got to partner up with Salvation Army, whoever's down there, and the Army, the National Guard, and all that, and go in and do something. We know what we need to do. Okay, we got to clean the water out. We got to go down there and get people on their feet. We got to save people who are stuck and all that kind of thing.
Get housing put back in, all kinds of stuff.
You guys don't know what you're doing. That's the problem. When you look right now at what the mess that you've created with this whole thing, and you can't even agree among yourselves. You don't know what you're doing. I read an article by Mona Sharon last night. It says, geez, I really don't know much about healthcare, but I stayed at Holiday Inn Express. I mean, that's what we've gotten around to here, Congressman, is that you guys, this is not like Katrina. You don't know what you're doing. You're guessing, and you're hoping, and no one has really ever taken the public option the whole way down the line and said, here are some of the unintended consequences of how this may come back around. I know that you are driven by honesty on this, and I know that you're driven by integrity on this, and I appreciate that you have stayed on this ship the whole way. Where I have a problem right now is the unintended consequences, I think, make us a little bit naive in where we're headed with this thing in the long run.
Well, as you well know, and I appreciate what you said, I got in, after those 31 years in the military, I got into Congress because of health care when my daughter had a brain tumor. So I know what I'm trying to affect. And as I told you, I've read the bill. I've gone through it. This is something, and I've modeled it on the Massachusetts health care plan.
Which is failing, by the way.
No, actually, it's not. It's gotten pretty decent reviews. Does it cost more than they said? Yes, it does. Yeah. I give you that.
And
but
therein lies the problem.
And it does not provide for universal universal coverage, there's still a number of people who are
97% of all Massachusetts have 3% have opted not to, and they pay a fine. So it's got 97% of them right now, according to the Urban Institute, which has completed its second study on it because it's 2 years. But here's the key. In the longer term, if, as we're not in our plan, just like Massachusetts, there are no fees for preventive screening, so colorectal exams or mammograms, because we want people to come in, find the disease early. Not only do they are more healthy if we catch a breast cancer early, but the cost to us finding it 5 years later is much more, so we save as society. Those types of longer-term preventive care savings aren't added into the savings and the cost that we talk about, or in Medicaid, the cost.
All right, let me jump in on you real quick.
So that's why I'm a strong believer in this. Are there unintended consequences? Yeah. There may be, but we know the consequences if we do nothing.
Well, we don't want to.
Americans nobody's saying do nothing.
No one's saying that. No one's saying, hey, listen, I've done it to you again. Are you backed up against us, or can you stick with us on the other side?
I'm actually meeting with a fellow from the CIA on Afghanistan.
Okay.
About 8:30. But how can I? I probably need him. Supposed to be in at 8:30. Would you mind if we stayed maybe 5 minutes on the other side?
Yeah,
8:35.
Yeah.
I probably have to get with him by 8:35.
Well, we won't be able to come back to you until about 8:35. So we got some people on the line here that wanted to ask you some questions, and
all right, I'll tell you what. I'll say to 8:40. Is that acceptable?
That would be good.
Perfect.
We'll
right,
keep you
in there. I just, I have a certain position in Afghanistan. I just want to see the latest.
Absolutely, and we appreciate you taking the time. You know that, and. We're honored to have Congressman Joe Sestak on this morning, who's running for the Democratic nomination for the seat presently held by Senator Arlen Specter. And, I wanted to read you a very quick thing here before we take the calls, Congressman. As Peter Orszag, Director of the Office of Management and Budget, you mentioned about the gross domestic product. He was talking about those Medicare and Medicaid costs, and he said if costs per enrollee in Medicare and Medicaid grow at the same rate over the next 4 decades as they have over the past 4, those two programs will increase from 5% of GDP today to 20% by 2050, quote unquote. You were talking about GDP. That's got to be a concern as well about fixing those things too, because they kind of go in league with what we're talking about when trying to.
Without a question.
Yeah.
I wish we had I wish the president's budget had better set the stage for dealing with next year's budget, which has to address our national debt, and we have to get it right on entitlement spending. Otherwise, by 2017, 82% of our GDP will be national debt. We've got to do that, or our children are going to suffer so much in higher interest rates and taxes. You are spot on.
Let's get to the phone lines very quickly. We appreciate you sticking for those few extra minutes. And John, you're on York's Morning News with Congressman Joe Sestak. Good morning, John. Welcome to WSBA. Your turn to make the call.
Hi, Gary. I'm going to try to be good. Don't really want to say what I want to say, but I watch them slither through my yard. Anyhow, questions. On these new agencies, the public option you're going to set up, are they going to pay property tax, state premium taxes, local taxes, and liability insurance, or are they going to take advantage of Section 42, and therefore you can't sue them because of Medicare preclusions? And by the way, Medicare was the #1 in denials last year of claims at 6.85%. That's my question.
Good question, John.
Thanks, John.
This public option, at least the one that is sitting in one of the two ways the House is going to go, and the one I'm a proponent of, is not funded by the government. It's funded by the premiums, co-pays, and deductibles of those who elect to join it. And so it's going to live or die upon how well it manages its money, just like Blue Cross Blue Shield. So it's going to be subject to the same types of taxes or anything else that Blue Cross Blue Shield is subject to. The only difference is that there will be someone like a public official like Secretary Gates or Secretary Clinton who decided to get $250,000 to run the public option instead of $25 million. So we are going to have lower overhead, and we're not going to pay advertising costs, or we're not going to have high profits, and we're not going to have a team of adjusters that try to deny coverage. And so, therefore, it's going to be a lot less enforced in Pennsylvania, where 70% of all private health care plans are controlled by two companies. They're going to have to compete for the 40 million, and I use the term 40 million Americans who are uninsured. I don't use the 48 million. The 40 million is uninsured. They get to pick which plan they want, and that's why we think we can have prices come down with these monopolies by competing for customers.
Congressman, they don't get to pick which plan they want if they don't want insurance, because they're going to have to pay a fine. They're going to have to pay something. And in the long run, a lot of these people are going to look out there and they're going to say, okay, I can pay this fine, and I can't be stopped for any illness I had before, and I can just get insurance then. I'll pay the fine now, which is far less, game the system, and then come back later on and pay for it when I need to.
It.
So, I mean, they're going to game. People are going to game the system.
Well, the fine is about 1.2% of adjusted gross income,
right.
So it's going to be roughly about what you'd pay for your own individual plan.
Actually, it's less by about $200 right now from what we figured out the other day. So it is less. I mean,
if it's $200, I'll go back and look at this. I mean, it depends. I imagine where you. I know.
Well, it depends what we come up with here at the end too, obviously, and that's part of it too. But at the end of the day, again, people are going to come back and they're going to say. You said they're not going to use any of the money from the federal government. The federal government has to give an infusion of the money to start, and they're going to pay that
right.
back.
There's a $10 billion loan that's amortized and all paid back.
But here's the problem. Suppose that, it fails. And what we've already seen how the government reacts when there are people who aren't allowed to fail out there. We go out there and bail them out again. Is this something where we're going to say, well, we need some more money?
Well, we know we're failing today. And so what we know in Pennsylvania is this. We have a cartel of insurance companies, two of them, that dictate
right.
prices. We know that in the last 8 years, health premiums gone up 100%.
Got that part down.
And we know that 700 people a day lose their health care coverage in Pennsylvania. So what do we do to fix that? In my mind is we have as much of an assessment as possible that I could have done and others could have done that said, if we put a competitor out there, do give it infusion to start up, let it be a choice to go to.
Well, but here, let me jump in on here, because we want you to put a competitor out there, but across the state lines, and we've talked about that, and yet no one wants to do the hard work, and a lot of people say, why is that? And we say, well, follow the money. Look at the lobbyists and look at people, and they're going to say, we're going to go out there and badmouth you insurance companies, and then we're going to take the same money and lobbyist money and so forth behind the scenes, and we're going to keep on doing the same old thing. And, the idea that we are not going to take down those mandates, which would cost you that kind of monopoly in a state, we're not going to do that. That's true competition. What you have out there is not even level competition, with all due respect. It's not.
I have to disagree. Here's why you see the insurance companies have condemned the Senate plan. They want the 40 million customers. But the Senate plan only gives them about 17 million. What they want is 40 million customers, and they don't also want a public option. Why? They don't want the competition. If you think that it's not a competitor, why do you think the insurance companies are vociferously against it?
Well, I want the competition. I just don't
then
think...
Then why not go with the public options? The other
I said I'm totally in favor of a public option, but the public option I'm in favor of is the public having the option as opposed to being forced into it ultimately.
The current public option, as defined by both the House and the Senate...
It's not a public option. It's a public push over the cliff.
It's the easy way out here.
No, you both made two comments here. It's the way over the cliff, and it's the easy way out. Those are assertions not based on fact, and you have to agree with that. I mean, at least I've given you a logic that says, wait a moment.
I'm not.
Pennsylvania,
you've given me a logic, and I understand exactly what you're saying. What I'm saying is, have you looked the whole way down the line, and have you explained clearly and openly to everyone, here's what might happen negatively down the line? And that's what congressmen should be doing, and I don't think that our Congress, and present company excluded in trying to do that, are doing exactly that.
Well, I can't predict what future Congress
but we have, that's
Congress
part
do.
of what we have
but I
to
have
do.
said, look down the road and said, look, if we don't have approximately at least 500,000 people join up, which is about the bottom line you need for a going enterprise to break into insurance market, then this public option will fail.
Well, let's get those calls in very quickly. With
yeah, because I've got to take one last call. I'm awful sorry. He's been waiting 10 minutes, this fellow.
All right. Well, he's, we'll
CIA, you know what I mean?
Hey, how about this one? People on Main Street, they're going to vote for you. Know what I mean?
You were an admiral, don't you trust the CIA?
Tell me which one. Ask him if he's in our state. If he votes for you, you're okay. But no, we'll go right there. Paul in Manchester, you're on York's Morning News on WSBA. Go ahead, Paul.
Good morning, gentlemen.
Good morning.
Congressman, my question has to do with, you guys talked a little before the break about the Constitution and how that applies. Specifically, you mentioned the general welfare clause as citing, philosophy of, why the government can force us to do something like this. And as an American, I mean, I don't want my government to force me to buy anything or that type of thing. So my question is, isn't the nature of constitutions, any constitution governing any body, and our American Constitution, U.S. Constitution specifically, to limit and define the powers of government and how it functions, and even if there was, and not the people, and even if there was confusion about the general welfare clause, isn't that cleared up in the Constitution itself when it talks about any powers that aren't specifically enumerated being reserved for the people and the states, respectively?
Yeah,
and,
I think you're talking about amendment number 10 there. And go ahead, Congressman.
Right. The Constitution, which I think is just about the best.
It's the supreme law of the land.
Piece of paper ever written in the world, along with the Declaration of Independence, is determined as we go forward. You have two schools of thought generally. There are those that say unless it's specifically enumerated in there. For example, it does
strict
say
construction
Congress
and broad construction. Yeah.
Yeah, it does say that Congress will raise armies. Okay, so boy, we know that's very specific in there. Then there's other more general clauses in there that you have those that say if it doesn't say specifically, don't do it. There are those, and I am one of them, that say, wait a moment, that means we couldn't provide for disaster relief for Katrina if we just say it's not written in there. It means that we could not help our commerce by building roads. It means we could not get education in public schools if we did not do it. So what you have then is a representative system where you vote, and I know I'm being a bit philosophical, but it's an important point he brings up, very important point, is you vote for those who are strict constructionists and say if it isn't in there you don't do anything, or you vote for someone that says, look, here's what I believe we should do with our future. I happen to believe a strong proponent of a healthcare system that's been run amok by the broken down markets and the health insurance. So I'm a believer, and I've been out there publicly on this show a number of times saying here's what I believe if you elect me, and therefore you all then have a choice to say nope. Well, I don't know if you get much of a choice with our inspector, no offense, because, I mean, he's going to be whichever way it is to get elected. And I don't mean that roughly, but you saw he just switched on the Defense of Marriage Act yesterday. Right. So my point is that what I'm trying to do is get out there and say, here's what I believe in Afghanistan. I'm a supporter of a measured increase in troops. Here's what I am. I believe that we are being damaged so much in our economic productivity that although I don't like to involved in the marketplace, I feel we got to put a competitor out, and this looks to me the best way to do it. And then you'd have to vote if you agree or not. There's no black and white answer to this. It's why we have two different parties, and I think it's healthy we do. And I personally think that gentleman's question is the perfect question. What do you believe your government should or shouldn't do? Right. But at least I should be out there explaining that not doing it, in my opinion, damages us where America has to go to compete with China, because we are losing $260 billion a year in economic productivity because people are out of work too much longer than they should be being acutely ill.
Yeah, listen,
and that's a decision every voter needs to make, what you believe.
I agree with you, and I think you have been genuine in trying to do that. We appreciate that, seriously, and you know that. We tell you that each time.
Yep.
I would say this to you, and this is the one place where we might differ. And I would say, you talked about your daughter, and that certainly drove you to probably have a much more passionate look at this whole healthcare thing than a lot of other people did. But by the same token, just putting something in is not a solution. We found that does not work. Just throwing money at a problem does not work, and that we need to make sure at the end of the day, doing nothing is also something that's not going to work. So we have to find the very best. And I think that's what we're calling on people to do right now, and not do something politically.
As I wrap, because I do have to be...
Go ahead, sure.
I want to say you hit a very important point. The failure of Washington, D.C. to be accountable for what they appropriate. to be accountable leadership. People want to be responsible down here and say, here's what I did this. But the follow-on, just like in the military, you have a commanding officer who sets the guidance, but then you have an executive officer who executes it and is responsible for accountable execution. You're right.
Yeah.
That is why so many people feel, wait a minute, you placed me in the savage recession somehow, and now you expect to fix the health care system?
And you build up Medicare and Medicaid and all those kind of costs?
And so the failure to be accountable, principal accountable. I don't care if someone disagrees with me. I just care that they give me an opportunity to explain and that I should give them the decency to listen. But I am going to promise you this when I'm the senator. You will have accountable follow-on leadership because I believe in it from my military days because you've hit why so many people feel Washington lets it go. Oh, new program, then you dash off to the next alligator to take care of.
Do one thing for me, this accountability thing. Don't just look back. Keep looking forward. And the one thing you could do is explain down the line how the public option might have some negative things, too, and be able to explain that to people openly, because a lot of these people are behind closed doors right now, and they're hiding. They're not out in the open like you are, Congressman.
And on the subject of dashing off to alligators, it's time for you to go to the CIA, Congressman.
We owe you,
Gary,
we owe
thanks
you
for having me. I look forward to our next time.
Thank you so much. So will we.
Take care.